Dehydration. In severe dehydration, if the IV line is not possible or if the IV line has failed, intraosseous access is given in the proximal tibia. It is preferred as an alternative in children less than 6 years. In children more than 6 years, percutaneous femoral line should be attempted. Oral rehydration solution ORS. Because of improved effectiveness of reduced osmolarity ORS, WHO and UNICEF are recommending that countries manufacture and use the following formulations in place of the previously recommended ORS. So, reduced osmolarity ORS, grams per liter, millimoles per liter, concentration is given. Sodium chloride, potassium chloride, glucose anhydrous, trisodium citrate, dihydrate. Okay, these are the things which are present in it. In sodium chloride is 2.6 grams per deciliter. Trisodium citrate dehydrate is 2.9. Potassium chloride is 1.5. Glucose anhydrous is 13.5. Sodium chloride 2.6. Trisodium citrate 2.9. Potassium chloride 1.5. Anhydrous glucose 13.5. 2.6, 2.9, 1.5, 13.5. Okay, so that is all grams per liter. Total reduced osmolarity ORS on the 20.5 grams per liter. Moving on to the specific ions: sodium, potassium, chloride, citrate, glucose. Citrate is 10 millimoles per liter, potassium is 20 millimoles per liter, chloride is 65 millimoles per liter, glucose and sodium are 75 millimoles per liter. Citrate is 10, potassium is 20, citrate 10, potassium 20, chloride 65, sodium and glucose 75. So totally it's 245 millimoles per liter in reduced osmolarity ORS. Oral fluid therapy is based on the observation that glucose given orally enhances the intestinal absorption of salt and water, and it is capable of correcting the electrolyte and water deficit. Risomal stands for rehydration solution for severely malnourished child. This represents the oral rehydration fluid recommended by WHO for severely undernourished children. These children are deficient in potassium and have a relatively high level of sodium. So for these kids, sodium given should be less, right? Risomal, that is rehydration solution for severely malnourished children, is therefore specifically designed with a lower sodium concentration and higher potassium concentration to meet the electrolyte needs of these children. Okay, so Risomal, okay. Lower sodium, higher potassium. Yeah. So the component glucose is 125 nanomoles per liter. Okay, so here what are all there? Same stuff: sodium, potassium, glucose, chloride, and citrate. Citrate in reduced osmolarity ORS-க்கும் இந்த ரெசோமால்க்கும் என்ன difference பார்க்கலாம். Citrate was 10 there, here it is 7. Chloride, potassium was 20 there, but here it has to be more, so 40 is there. Chloride was 65, here 70. Sodium and glucose both were 75 there, but here sodium is less, 45, and glucose is 125. So specifically speaking about Risomal, citrate 7, potassium 40, chloride 70, sodium 45, glucose 125. Citrate here is 7. There in reduced osmolarity, citrate was 10. Okay, and then potassium was 20 there, here it's 40. Chloride was 65 there, here it is 70. Sodium was 75, here is 45. Glucose was 75, here is 125. These are all nanomoles per liter. Okay, apart from that, magnesium is there. Magnesium, zinc, and copper. Magnesium is 3 nanomoles per liter. Zinc is 0.3 nanomoles per liter. Copper is 0.045. Osmolarity totally is 300 nanomoles per liter. Okay, magnesium, zinc, copper. Magnesium is 3, zinc is 0.3, copper is 0.045, osmolarity is 300. All these are in nanomoles per liter.